and thank you for joining us. You're watching Arirang News, coming live from Seoul. I'm Shin Se-min. We are coming on the air to bring you live coverage of a briefing from South Korea's health authorities for the latest on the coronavirus outbreak. In moments' time, we will be cutting over to a briefing site, the Central Disaster and Safety Countermeasure Headquarters, for the latest official tally on the coronavirus situation and much more. And we will also provide you with live interpretation of the officials' remarks in English simultaneously. And as we came on the air, we have learned that the total number of confirmed COVID-19 cases here in the nation has reached over 9,241 as of this morning, up 104 from the day before. And the death toll with that also went up to 104. It looks like we are getting live footage, and we're going to cut over to Yoon Tae-ho, a senior health ministry official in charge of the containment measures.
Mr. Yoon Tae-ho, the chief of Quarantine Supervision Department, will give his briefing, and the Q&A session will be carried out via online chat room. We also have sign language translation available. Here is Mr. Yoon Tae-ho. Let us now begin our regular briefing for March 26th, Thursday. As of today midnight, the total number of people in quarantine stands at 4,966. 414 more people were discharged, and 5 more people have died, with the death toll standing at 131. The confirmed number of confirmed cases stands at 8,241, up 104 from the day before. I would like to send my deepest condolences to those who have passed away. As of today midnight, among the 104 increased cases, 57 cases were related to imported cases. And there were 30 cases that have been tested positive at the airport quarantine, and the rest were related to community infection. The majority of them were Korean nationals, and the rest were foreigners. And this makes the total number of imported cases 284, and 90% of which are Korean nationals and 10% are foreigners. And this morning, Prime Minister convened a KCDC meeting during which he touched upon issues including intensifying the effectiveness of self-quarantine, as well as a social distancing campaign carried out throughout the country, and the supply of face masks. Prime Minister Chung Se-kyun said that self-quarantine measures need to be put in place strictly, and he called for the cooperation by the local municipalities, and so that we can curb the further spread throughout the society. He also said and stressed that unjustifiable breach of such measures will never be tolerated. And as we near the starting of the new school year, he said that many people are sending their kids to private education institutes, but he stressed that it's desirable not to send them to such facilities, at least until the end of next year. He also asked the Education Ministry and related ministries to supervise these institutions. Today marks the 5th day since the government has put in place an enhanced social distancing campaign. And yesterday, we have intensified our supervision on 15,000 some nightlife venues, including the karaoke rooms. And we also put in place administrative orders. This morning, at the KCDC meeting, we touched upon the issue of enhanced social distancing measures carried out in Yeongnam region, including Busan and elsewhere. And we were briefed about the public social distancing campaign that are carried out in these regions. And including high-risk facilities, including religious and nightlife venues, we also established a separate team for supervision in order to enhance our monitoring and supervision. We also touched upon the issues of providing immediate and emergency funds for these businesses, and we also came up with measures that are tailored to each of the municipalities, including the giving out of a gift certificate that could be used in different parts of the country. And starting from the 27th of midnight, midnight, we made clear yesterday that we will implement a mandatory self-quarantine on all of the arrivals from U.S. as well. And a majority of them, about over 80% of the inbound travelers from the U.S. are Korean nationals. And all of those who have symptoms will be tested at the airport immediately upon arrival. And for the persons without symptoms and who are Korean nationals will be put on self-quarantine. And if symptoms occur, they will be tested. And for foreigners who are on a short-term visit without domestic residence, they will be tested at a temporary facility. And if they are tested negative, they will be allowed entry and will be under active monitoring. And we will also enhance and strengthen the management of inbound travelers under self-quarantine. They will be mandated to install the self-quarantine mobile application on their phones, and they would have to check their temperatures, and they need to report their health conditions to the local governments. And all of the cases will be put under intolerance, meaning that everyone needs to abide by such measures. And for the inbound travelers from US and Europe, we ask you to participate in such measures strictly. Starting from this afternoon, we will enable more walk-through facilities at the airports. Considering the conditions of the airport, which is very windy, we will have open 5 new facilities for screening centers. And while the conventional temporary center screening centers need time, these walk-through centers can test about 12 people in just an hour, which is even faster than the drive-through facilities. They will be stationed a total of 16 with 8 at the Terminal 1 and Terminal 2 respectively. And we believe that the maximum number of the testing will be carried out on about 2,000. And we also mobilized our soldiers as well as public doctors and nurses and volunteer workers to enhance the effectiveness of the screening at the airport. And in light of the global spread of the coronavirus, we believe that everyone is put at risk. And we would also like to advise for all of the inbound travelers, aside from Europe and Europe and US, to abide by measures like self-quarantine measures as well as wearing face masks. And we will also be intensifying such entry measures if necessary. And we will also like to brief you upon the nursing hospitals. And nursing hospitals, especially the professional caregivers, they are not directly employed by the hospitals, meaning that they are more prone to infections. And we have established a monitoring system to go over and review all of the conditions of all of the caregivers that work at the hospitals. And in order to solve the shortage of face masks for the caregivers, we consulted with the related ministries, and starting from the 24th of March, we have increased our supply to 30,000 per day, and we are supplying them with these face masks. And we are also mandating their screening, and these will be carried out with the financial support of the local municipalities. I ask for the close cooperation by the nursing hospitals. We also will provide any financial subsidies for the local nursing hospitals in order to expand the scope of the health insurance coverage. And in order to mitigate their financial burden, we also will provide as financial fund of about 1,000 Korean won to all of the inpatients. And we will also like to brief you about the amount of blood that has been secured. And we have restored the issue of a shortage of blood. And however, blood donation is very difficult right now because of the spread of the virus throughout the community. And we believe that we have a possibility of a risk of shortage of blood in the short future. And I would like to ask all of the public to participate in the campaign of donating your blood. And we will put our utmost efforts to ensure the safety of blood donation. And as for military personnel who are proactively partaking in such campaign, we will also help you to mitigate the infections of the coronavirus. And we also will intensify the qualifications and of those who have been in contact with the self-quarantined people will be restricted from donating blood. We are still witnessing wide cluster outbreaks here in Korea, and an increase of the inbound cases as well, imported cases as well. Therefore, we cannot let our guards down as of yet. And we also have an open possibility of a higher risk of cluster infection here in the community. And I ask you to participate in our enhanced social distancing measures for the next 10 days. Above all, we ask you to wash your hands frequently. And if you feel sick, please stay at home and maintain physical distance with each other and have regular ventilation as well. We had an interim report from the call center case, and we said that the infection rate was over 40% because it is very risky to have a large gathering at a closed-door place without ventilation. Is very risky for infection. All of the public have shown a high level of civil awareness. I thank you all for that. And I also thank all of the dedication put forth by the medical staff who are fighting on site to combat the coronavirus outbreak. Thank you very much.
There you have it. Just to wrap some of the details we just heard, South Korea has confirmed that the total number of confirmed COVID-19 cases stands at 9,241, with the death toll standing at 104. And that also puts the number of cured people at 4,144. And some of the information that we just heard also from the briefing was that of the 104 newly infected cases as of this Thursday, 57 of them were confirmed to be imported cases from overseas, putting a whopping 50% of the confirmed patients coming in from newly imported cases. And that also puts the nation at growing concerns over the number of containment among imported cases. And it also said that officials are continuing to keep a closely monitoring the inbound travelers at the same time, and added that the Incheon International Airport will be setting up a total of 16 walk-through testing sites starting today, 8 at Terminal 1 and the remaining 8 at Terminal 2, hoping to host at least 2,000 people a day coming into South Korea through the Incheon International Airport. And apart from the numbers, the government also urged all parents in South Korea to keep their children away from returning to private academies until next weekend, and also said that South Korea is monitoring high-risk and nightlife areas, and this as reports of growing number of patients among younger generations, those in 20s and 30s. And that does it for us at this hour. Our next news lineup coming up at noon Korea time, and that will be less than an hour from now. As always, thank you for watching, and goodbye.